Alright guys, let's talk about polishing. So first of all, what is polishing? Well, it's basically when you get a dental cleaning, usually either at the beginning or at the end of an appointment, the dental assistant or the dental hygienist will go in and polish your teeth with a tool that's officially called a prophy angle. They'll fill it with some polishing paste and just go around and polish your teeth. Now, some people believe this is an essential part of the cleaning, or even think that it is the cleaning, but it's actually not. In fact, in school, dental professionals are taught to be selective with their polishing, especially avoiding polishing things like crowns and implants. This is because polish is super abrasive and can cause microscopic little scratches on your restorations like crowns and implants, and over time it can actually abrade your enamel and wear it down. So if that's the case, why do people think polishing is necessary? Well, what happens is when you're a kid, polishing is the cleaning. See, polishing helps remove soft plaque, which is what most kids have, just soft plaque above the gum line. Plus, it's a lot less traumatizing. There's no sharp instruments involved, and you get to pick fun flavors, so polishing is the way to go to clean kids' teeth. But as we transition to adulthood, we're kind of conditioned to believe that it's part of the cleaning, and so we carry that notion with us into adulthood, and oftentimes dental assistants or dental hygienists don't really want to fight that misconception, so they just kind of go along with it and polish everyone's teeth as standard practice. I remember some of my patients, when I tell them I'm not going to polish your teeth, they would freak out and be like, who are you? Like, you're a horrible hygienist. Why wouldn't you polish my teeth? It's the cleaning. So it would take me some time to explain, and then they'd be on board. But a lot of times hygienists don't want to deal with that, so they just do it. So the question is, when should polishing be done for adults? Well, it's great if you have a lot of soft plaque, as I mentioned before with kids, or if you have a lot of surface staining. Now, this is why I personally like to polish at the beginning of an appointment. That way I can remove any soft plaque and stains so I can see where I need to do a little bit more heavy lifting with my instruments and my ultrasonic scaler. Now, in terms of stain, please understand that there are a lot of different types of stain, and you need to trust your hygienist to determine which kind of treatment and which kind of instruments to use to remove your stain. Often patients come in and say, you better polish my teeth because I have a lot of stain. Or maybe not so rudely, but you get the idea. But sometimes that stain is actually just old fillings that the little margins of or the edges kind of get discolored or absorb colors over the years, and that's not something polish can remove. Or sometimes patients have a lot of bone loss and exposed roots, and there is a lot of stain that can be removed on the root surfaces, but root surfaces are a lot softer than enamel, and any kind of excessive scraping or scrubbing with the polish can actually damage the roots. And since stain is purely cosmetic and it doesn't damage the health of your teeth or your gums, sometimes it's just better to leave it there and not scrape it off and cause damage to the roots. By the way, if you guys are finding this video helpful, don't forget to give it a thumbs up and subscribe to my channel for more videos like this. Now, speaking of stain, one great way to help reduce the amount of stain that you collect on your teeth is to actually use hydroxyapatite toothpaste. Now, I've made a lot of videos on hydroxyapatite, so if you guys want to check up on that ingredient and different brands of toothpaste that use it, you guys can check out my playlist called Hydroxyapatite. I'll leave a link in the description below. But the thing about stain is it adheres to rough surfaces and imperfections in your enamel, and hydroxyapatite actually over time helps to rebuild those microscopic imperfections and smooth out the enamel so that stain doesn't adhere as easily to your teeth. I've noticed this on my own teeth. I've collected stain on certain areas of my teeth for many years, and after I started using hydroxyapatite toothpaste, over time those stains have virtually disappeared. Alright, shoot me your questions or comments below and I'll get back to you as soon as possible. Otherwise, thank you guys for watching, and I'll see you in the next video. Take care of your teeth.